Hello, everyone. Thank you so much for joining us tonight. So I'm going to get started. It's 7:30. My name is Brianna Ripka, and I am the PA Civic Programs Manager for the League of Women Voters of Pennsylvania. And I just want to thank you all for joining us this evening for our webinar, Gun Violence as a Public Health Approach. For your awareness, this webinar is being recorded, and as an attendee at this webinar, your camera is turned off, so your face will not be included in the recording. As a reminder, there's closed captioning available in Zoom. To enable closed captioning on your screen, you could click the live transcript option in your Zoom taskbar. If you need more assistance with closed captioning, I'm dropping a help document in the chat. We begin this time together with a land acknowledgement. We in Pennsylvania acknowledge the land ownership of the original indigenous peoples, honoring the Haudenosaunee Confederacy and the great nations of Pennsylvania, the Erie, Iroquois, Munsee, Delaware, Shawnee, Ohio Valley, Susquehannock, and Lenape. The League of Women Voters is a nonpartisan, nonprofit organization, and our state office oversees a grassroots network of 30 local leagues all across Pennsylvania. The League encourages informed and active involvement in government while working to increase understanding of major public policy issues and influences public policy through education and advocacy. To learn more about our work and to subscribe to our action alerts, please visit our website, www.palwv.org. I'm also going to drop those links in the chat. So I'm pleased to welcome you tonight to our webinar, Gun Violence as a Public Health Approach. To watch any previous recordings or to sign up for future events, please visit the links in the chat. And throughout tonight's presentation, you're welcome and encouraged to ask questions using the Q&A function in Zoom. So we'll leave about 10 to 15 minutes for Q&A at the end of the event. But please note, we'll only be answering questions through the Q&A tool. I'll now pass it over to our state board member, Angelica Chahan.
Hi, everyone. Thank you so much for taking the time to join us tonight. I'm pleased to welcome our internship program who made this webinar possible. So our two interns that will be joining us today are Leah and Martina on the panel. And we also have another intern, Mia, who is unfortunately unable to join us today. But our three interns were selected from a really wide pool of applicants from all across Pennsylvania. And throughout this past year, they've had the opportunity to work with the League on a research project of their choice, from which they chose looking at gun violence as a public health issue, along with the League of Women Voters of Pittsburgh and working with them together. They've done an excellent job, and we're really excited to share our research with you today. I'd also like to welcome Nancy and Preston from the Pittsburgh League of Women Voters who have supported us a lot throughout this project. We're really grateful to have worked with them and learned so much from them. So for this webinar, we'll be starting out with about a 15 to 20-minute presentation from our interns, Martina and Leah, and then we'll move into a 10 to 15-minute Q&A session, as Brianna has mentioned earlier. So without further ado, I'll screen share my presentation and Leah and Martina will start their presentation. So this is our League of Women High School internship program, and we looked at gun violence as a public health crisis here. And Leah, you can take it away from here.
Recently, the rate of gun violence in the United States has increased, leading to widespread advocacy for more effective solutions. Many have called for more attention to be given to this issue in a holistic approach that includes mental health support, policy reforms, and social programs in communities to mitigate the impact of gun violence. This presentation aims to identify the most effective approaches to lowering gun violence, specifically through a public health lens. Studies found that enacting a public health approach to guide legislation and other reforms is one of the most effective approaches. In terms of mental health support and community programs, Taking a public health approach would help to prevent gun violence by recognizing its signs and patterns, while also providing more resources for victims. In terms of policy reforms, having a public health foundation for legislation ensures that all aspects of this issue are taken into consideration when writing policy, especially socioeconomic factors like race and economic class. It will also help to prioritize a preventative approach to policy rather than a reactionary approach. Our presentation will take a comprehensive view of gun violence by looking at the methodology of gun violence data, identifying different results, and then analyzing the results to find a solution that is both practical and effective at decreasing gun violence. So, to introduce this project, in 2022, gun-related injuries became the leading cause of death among children and teens, claiming nearly 4,400 young lives. Most people don't understand or know that gun violence can be a public health issue. It is driven by poverty, racial inequality, and gun ownership, and is prevalent in underrepresented communities such as Latinx and Black communities. This surge in violence then leads to complex mental health issues in communities. The purpose of this presentation and our literature review that it's based off of is to find comprehensive solutions by viewing gun violence from psychological, social, and environmental perspectives to create a holistic view of this issue. Considering all of these elements together will help us to reduce gun violence. In this presentation, we analyze recent studies on gun violence to see whether taking a public health approach to lowering rates of violence is effective. These articles were analyzed to identify what policy approaches, programs, and social reforms the authors believed should be enacted. The solutions we identified were then compiled together and evaluated for their effectiveness based on the ability to apply them to real life, what groups they would impact, and what difference they would make. Once all solutions were analyzed, the most applicable ones to the League of Women Voters of Pennsylvania were identified and further researched for this review. The research we looked at examined data on firearm-related fatalities, community risk factors, and prevention strategies that are both evidence-based and scalable. It was found that individual access to firearms significantly increases risks of both homicide and suicide. On the community level, factors like poverty, limited economic opportunities, and structural racism were shown to correlate with higher rates of gun violence. Key protective strategies used to mitigate gun violence include promoting safe firearm storage, enacting extreme risk laws, and developing violence intervention programs at the community level to prevent retaliatory violence. Additionally, our research highlighted the effectiveness of policy changes to enact large-scale protections against violence. This research underscores that gun violence is not only an individual problem, but a societal one, influenced by deeply rooted socioeconomic and racial disparities. Addressing gun violence requires tackling these structural issues through evidence-based policies that prioritize equity and access to resources. The public health model of injury, one of our main sources for the methodology of this review, was previously used in societal, larger personal, and environmental contexts of motor vehicle injuries. This methodology is useful because it facilitates policy changes. In the context of its previous use, this model helped regulate the types of vehicles people could drive, who could drive, as well as under what circumstances people could drive. In a gun violence context, this model would help guide policies governing firearm use, bolster community interventions, inform standards implemented across healthcare settings, and depoliticize the issue of gun violence. This is largely because it takes a scientific approach to policy and considers all sides of the issue, including those that are normally overlooked, such as socioeconomic factors. The photo on this slide outlines the scientific process of this model. It begins with data collection and then analyzes data to find specific risk factors that can then be addressed through the implementation of policy and programs.
The primary prevention framework. So this kind of framework incorporates public health principles, the primary, the secondary, and tertiary prevention. They have been used before. Some of these previous uses include applying the public health prevention models, again, the primary, secondary, and tertiary, the whole school, whole community, whole child, WSCC model to school gun violence prevention. Policy analysis was also used by reviewing some current school safety regulations. But now let's put it in the gun violence context. So, in the gun violence context, this can be used for a community based approach and also a trauma informed approach. Now, for some implications, so these emphasize the need to prevent gun violence by shifting from reactive measures to a more holistic strategy and requires an integrated outlook that addresses not only the root causes of gun violence, but also the immediate aftermath of it. So, the results. So, the problem is that exposure to gun violence has an impact on children's and teens' psychological but also mental well being. And it affects many different factors, such as their school performance, their mental health, and also their physical well being. The study notes that Black and Latinx children, especially those in urban low income areas, are the ones that are impacted most disproportionately. The results that the study found is that any exposure to gun violence has a lasting impact on the emotional and physical well being of a child or a teen. It concluded that children exposed to gun violence are more likely to not only abuse drugs and alcohol, but also suffer from depression, from anxiety, and PTSD, resort to aggressive and violent behavior, and engage in criminal activities. Additionally, due to policy decisions that enforce racial segregation, gun violence is mainly concentrated in Black and racial minority neighborhoods, meaning that Black children and teens in the US are 18 times more likely than white children to die by gun homicide. The same pattern exists for Latinx children and teens. So, to prevent this, the researchers suggest a variety of policy changes, which include background checks on gun sales as safe storage laws to make it more difficult for individuals with a record of violence to acquire firearms and other weapons. So, our recommendations as high school students on how to address gun violence fall into three separate categories. First, re examine policy and laws related to gun violence. Second, take a public health based approach to solutions for gun violence. And third, provide more resources for community programs to address risk factors.
In order to reduce the rates of gun violence incidents, we should have background checks on gun sales. This means that to buy a gun, people would need to have a background check regardless of who they are. This would close the current loopholes in gun violence policy, allowing domestic abusers and convicted felons to purchase weapons. Extreme risk protection laws are also crucial because they allow family members and law enforcement officials to testify before a judge in order to block a person from possessing a weapon if they are believed to be a threat to themselves or to others. In addition to that, secure storage and child access prevention laws ensure firearms are stored responsibly, preventing dangerous access to weapons, especially by children. Addressing socioeconomic disparities, such as structural racism, poverty, and economic inequities, is also essential in reducing gun violence, particularly in communities disproportionately affected by it. To accomplish all of this, increased research and funding should be directed towards expanding studies on gun violence and implementing effective public health strategies. Overall, enforcing stricter gun laws, including raising the legal age for purchasing firearms to 21, can help reduce gun violence in our schools and communities, especially since perpetrators of gun violence at schools are often teens or underage individuals. In terms of policy recommendations, for the purposes of this presentation, we decided to highlight background checks and extreme risk protection orders, also known as ERPOs. As you all probably know, background checks have been a frequent discussion in Pennsylvania due to the current loopholes that exist. One example is that in some cases, private sellers can avoid background checks. According to research done in 2023 by Giffords Law Center, private sellers are not necessarily required to initiate background checks when transferring a long gun in Pennsylvania, although federal and state laws prohibiting certain people from purchasing or possessing firearms would still apply. Given instances like these, we would recommend increased research and collaborations with nonprofit centers focused on law and gun violence to identify loopholes and issues with current policies. This can help us advocate for specific and targeted chances. The other policy recommendation we researched was extreme risk protection orders, also known as ERPOs. These orders are designed to be preventative measures and are usually court orders that temporarily suspend a person's ability to possess firearms if they have been deemed to be a threat to themselves or to others. Currently, there are two bills in the House and the Senate that could install ERPOs in Pennsylvania. 21 states have ERPO protections. Ceasefire Pennsylvania also has an initiative to encourage government officials to pass these bills.
All right, so now moving into the public health approach, number 2. So in order to address the mental health issues caused by gun violence, this issue must be viewed in the context of a public health approach, meaning that gun violence would be treated as a public health epidemic. It is critical that gun violence be viewed as a public health crisis because it would allow all of the factors that play into gun violence and its resulting trauma to all be considered, especially the factors that are most often ignored or silenced, such as race and socioeconomic standing. Considering gun violence to be a public health crisis will also help depoliticize this issue, as it will be viewed as something that impacts every single person, regardless of party affiliation or partisanship. If gun violence is viewed as public health issue, more resources will be provided to hospitals and healthcare facilities so that there is a sufficient amount of workers, space, and materials. Along with this, mental health resources in schools and hospitals must be strengthened and made more accessible. So moving into research. So as a result, we looked into public health data availability in terms of research. The first aspect we considered is data collection. In October of 2024, PA Code 6.984 was passed, which would establish a gun violence data dashboard for the state of Pennsylvania. This will include data from the Pennsylvania Commission on Crime and Delinquency, also known as the PCCD, the Department of Health, the DOH, the Department of Human Services, DHS, and Pennsylvania State Police, PSP. And other relevant agencies will collaborate to share data. This renders it to be a very collaborative and effective means to track data. We would recommend for the league to keep tracking progress on this dashboard through looking for timelines or detailed plans by the states. The other aspect we researched was the reporting of gunshot wounds. Currently, healthcare workers are required to report gunshot wounds to law enforcement, but not necessarily the State Department. In this case, we would recommend looking into increased transparency and methods to encourage reporting to the State Health Department as well. So our third recommendation is community intervention strategies. To address gun violence, community-based intervention is needed. In schools, funding for mental health programs has been shown to decrease violent behavior and also improve emotional well-being. For example, Chicago Public Schools Violence Prevention Program, which incorporates therapy services and conflict resolution training, has successfully reduced violence and provided support to at-risk youth. Also, safe gun storage initiatives like Project Child Safe address the 4.6 million children at risk due to unlocked guns in homes, helping prevent children from accessing firearms. Additional resources and solutions include mental health training for teachers and staff, community-based mentorship programs for at-risk youth, and public education campaigns to raise awareness about gun violence, prevention, and mental health support. These strategies all collectively address the broader factors contributing to gun violence, fostering safer environments in schools and communities. The photo that you see on your right is Safe to Say PA, which is a resource by the Pennsylvania government where if you hear something, if you see something, anything that's suspicious, you can report it there anonymously, and emergency services and police will be alerted as soon as possible. Before we conclude, I wanted to highlight State Representative Amanda Cappelletti's perspective and solutions that she herself offers to gun violence. So as the state representative asserts, and I quote her words, gun violence is a multifaceted phenomenon in this country, which is why we must confront it as a public health crisis that it is, end quote. Senator Cappelletti goes on to list the different goals, which are to make firearm use as safe as possible, emphasizing the importance of keeping guns out of the hands of people who shouldn't even have them in the first place, investing in violence prevention strategies that are backed by data, and improving data and research to better comprehend what causes violence and then how we can prevent it. Senator Cappelletti also points to efforts already underway, such as $600 million in funding through 3,500 plus PCCD grants for violence prevention, Governor Shapiro's 2025-2026 budget, which adds $10 million for local violence intervention programs, and another $10 million for boost grants, supporting after-school programs that address root causes of violence and help keep our communities safe.
In conclusion, to address the effects of gun violence, the issue must be viewed in the context of a public health approach, meaning that gun violence will be treated as a public health epidemic. This approach can be used to implement policies and community intervention programs that target public safety and take socioeconomic factors into consideration. These strategies collectively address the broader factors contributing to gun violence, fostering safer environments in our schools and communities and therefore creating safer environments. Thank you.
Thank you.
Thank you, Martina and Leah, for your excellent presentation. We hope that this has been helpful in sort of understanding the work that we've been doing with the research, and we decided to put out quite a few recommendations out there for the league to consider and look at, and hopefully point further directions on the new position that has been adopted. We'll now be taking any questions through the Q&A chat, as Brianna mentioned earlier, so feel free to drop in anything that you're wondering about.
I just want to say thank you so much. We're so incredibly proud of Leah and Martina for their research they contributed to tonight's conversation on gun violence as a public health issue. And their works is a powerful reminder that the next generation isn't just watching, they're also stepping up to be a part of the solution. So yeah, it looks like we have one question so far in the chat. I encourage others, if you have any question, please use the Q&A tool at the bottom of your toolbar. Roberta asks, if you had one recommendation, what would that be?
Sorry, Leah, go ahead.
One thing that really stuck out to me in our research was the safe storage laws, which basically ensures that guns in the household have to be stored in a certain way so that children and other members of the household that shouldn't have access to those guns can't reach them. And something that I learned through our research is that a lot of these mental health issues related to gun violence begin in the household and in families. So I think these safe storage laws would help to take a preventative approach to stop these mental health issues in children before they even start.
So I would have two recommendations. One geared towards like the populace, like us, and then one geared towards like the people in our government. So for like the populace for us, something that really stood out like in our research is how much school efforts really play a crucial role in it. Because teachers, they see their students. So if they see their students acting a little suspicious, acting a little weird, like they should speak up. And so as long as also their classmates do as well, because like their classmates also know each other. So if there's something going on like in the classroom, all the resources that people have been investing on, people should keep on investing in resources to help out schools, to have after school programs, to have like the programs like the Chicago school that we talked about had, because that could really, really help target the root of the cause, I believe, and could be really helpful in like reducing the rates and also targeting it. And then for the people in our government, for our state representatives and the federal and the state and the local level, something that like a recommendation that I would give to them is just start actually caring for everyone, like regardless if you're Republican, regardless if you're a Democrat, like gun violence affects every single one of us. Young, old, elderly, adult, every single one of us. So you're there because like we elected you and you should be caring for all of us regardless of party affiliation. So yeah.
Thank you so much. That was great. We have a couple more questions. Judy says, congratulations to all three student interns who did so much research and who presented it so well. I hope we have access to these slides and to the students' full report. So, yep, we will be sure to share these slides with everyone after the presentation. We have another question from Bill. He asks, how would you deal with the tradition of hunting in PA, which is very important to many? Some start hunting as a teenager or younger.
I think,
I'm
oh,
sorry,
sorry.
go ahead.
I was just going to reiterate what you said earlier about safe storage protections and making sure the guns are kept away from young children who could have access to them without adult supervision. But Leah, I'll let you continue on this thought.
Yeah, I think as I was speaking about policy, a lot of these policy implementations are regulating who can have guns. So, for instance, we want to prevent potentially dangerous individuals, such as people with a track record of domestic abuse,
Mhm.
from having guns. And in relation to hunting, of course, people do have the right to do that. What implementing these policies would do is not only protect that, but ensure that it is safer by ensuring that the people who do have the guns and who are introducing the tradition of hunting to their children are responsible gun users and will not abuse the guns and potentially harm their kids with it.
I definitely agree with everything that Leah has said, but if there's something that like I would add, if there's like a potentially dangerous individual, then their gun should be confiscated if they are a hunter. I would also add with teens that are starting to have access to these guns, I feel that the regulations should be a bit stricter, like not letting teens hunt, not all because they're dangerous, but just to protect themselves and also protect like other people from them as well.
Thank you both so much. I had a question, and if anyone else has any questions, please feel free to answer them in the chat. I was wondering, how did looking at gun violence through a public health lens change the way you understood the issue, if it did?
I think looking at it through a public health lens um, sort of introduced it in a more scientific way. In the past, I had seen it more through like political advocacy and a lot more like partisan based, whereas I think the goal of like a public health approach is to depoliticize the issue so that we can all find common ground on finding a solution. And I think that was something that was definitely very different when I started looking at through a public health approach.
I agree with Leah with what she said, but something that really stood out to me is how heavily mental health plays into gun violence. Like I always knew that mental health had an important role in gun violence, but I didn't realize how huge it was. So I feel that by looking at it through the public health approach, not only does it like also take in mind the the facts and everything of that, but it also has to do with what actually happens like in the person's mind as well. And I feel like a lot of people don't really understand that or don't really know that. And the public health approaches brings into light that. So people are more aware, so people can know, hey, like it's very bad. It's not just like, oh, it's just the people that died or oh, just someone who just got a gun. No, it's beyond that. And I feel like the public health approach really does a good job with that.
Thank you so much for that. And Roberta asks, will there be a similar internship program in the future? I believe so. Angelica, do you want to speak on that a bit more?
Yeah, we hoped so. We had a lot of applications from all over the state, so we hope to give also more students opportunities to work with the league and learn more. And our students this year did such an excellent job. This is our first year ever doing the internship program, so I'm really excited to see where this will go.
Thank you. And Nancy had a question. She was wondering, What do you think children should be taught about guns in schools, elementary, and then older kids? So I think at the different levels there.
I think in elementary, since obviously like they're very, very young, they shouldn't be taught about like the mental health nitty-gritty part of it just yet. They should be taught that guns are bad, they're not good. You shouldn't use them. Your parents should have them, locked up. Obviously, like not in the words that I'm saying it, like in more elementary school type kind of vocabulary. But for the older kids, like middle and high school, they should start like being taught like the public what it has to do, what like having a gun, the bad effects of having like a gun, of using a gun, of hurting someone with a gun, why using a gun is not good, um, the effects that gun violence has not only on yourself but also on communities at large, to your health, to your well-being. That's what I think should be taught like in middle/high school kind of age.
I definitely agree with Martina. I think, especially with how gun violence impacts schools and young children now, I think it is important for them to have an understanding of the issue. Um, And I think also something that we came across in our research is taking a preventive approach rather than a reactionary approach. I think with the resources schools have now, teachers obviously do their best, the best they can do, to inform children about the issue of gun violence. However, a lot of the resources in school go to reacting to incidences of gun violence and what students should do um, in case of like an intruder, rather than how can we prevent gun violence, what is being done. And I think that is something going forward that could be more talked about in schools.
Thank you both. So Ruth has a couple comments and questions. So she says, "Wow, as a former high school teacher, I'm so impressed with your research and presentation skills, A plus. And also, did you run into a debate about red flag rules to take guns away from people with depression or other mental health issues? For an example, might prevent people from seeking treatment if they may lose their guns."
That was definitely something we did research on. Yeah, one of the policies we did research on was something that would that law enforcement and loved ones of that potentially dangerous individual would get involved and get a court order against them. In terms of debate, I definitely ran into debate about that. And that was something we didn't really include in our presentation, but yeah, I think especially with how much our presentation focused on mental health and it is such a delicate issue, um, analyzing that and how maybe these policies could, while also positively impacting mental health, may also negatively impact mental health is something we should definitely analyze.
Yeah, I definitely agree with Leah. I think we did run into it, but we didn't really like spend a lot of time on it. Yes, I definitely do agree that there is like both the positive side of taking it away, but then again, also has like its negative outcomes. Because if we take it away from them, it could help the community. It could probably help them themselves as well. But again, if we also take it away from them, their mental health issues could also like increase as well. And when they get the gun back, you don't know what they can unleash. So I feel like there needs to be like a good balance between that, which I'm not sure what can be, but there has to be like a good balance between like should we not? It is definitely worth looking for and like doing more research and including that like into the public health approach.
Great. And Roberta asks, do you think these mental health issues are compounded by social media, television, and movies that are full of guns and violence?
Yes, definitely. A lot of people say no because it's movies, it's films, it's entertainment. But especially younger folks like teens and middle schoolers, since they're normally the ones that are on social media, watching movies, watching Instagram, TikTok Reels, etc., if they see guns, if they see people abusing how they use guns, they can definitely feel inspired to also unleash rampage on their communities and on their schools. A lot of school shooters, that's what they do. Like they get inspired by a movie, they get inspired by a video, and that's why like school shootings happen in the first place. To answer your other part of the question, if mental health issues are compounded by them, definitely mental health issues do come along with like the violence that they unleash. And I definitely think that it is a problem and it is worth adding that under like the public health approach as well.
I would definitely agree with everything Martina said. I think so many young children have access to social media, and part of that is being exposed to a lot of violence and gun violence. And I think what that does is sort of normalize violence and gun violence in the minds of these, very young and impressionable people. Um, and like Martina said, part of social media is that people will be exposed to these really extreme and maybe even radical ideas. And, you know, that may have these really dangerous impacts on teens and may lead to violent behavior.
I also wanted to add something on if I can, if there's time. Yeah. Okay. So there's this thing called copycat crimes. So when someone who committed a crime, their crime is televised, it's on the news, it's everywhere. And then there's another person that's sitting on their couch looking at the TV and they get inspired to commit a similar crime, but to have like more victims. That could happen with all the entertainment, with all the films, with all the music videos sometimes, lyrics, and different forms of entertainment that expose people to gun violence, to shootings, to using guns, etc.
Thank you for uplifting that. Yeah, that's great perspective. The next question that sort of is similar, Judy asks, could you speak more about the psychological impact of gun violence on children of all ages? I think you touched on this a little bit. If you could speak on it more, that'd be great. Thanks.
Yeah, I think something we came across, I kind of spoke a little bit about this earlier, but seeing gun violence and just violence, period, at such a young age normalizes that behavior in the mind of these children. You seeing that kind of behavior at such a young age and at a time when your mind is just like starting to take shape, really influences your behavior in the way you think. Um, and seeing that can inspire more violent behavior and can sort of lead to, a mentality of I need to protect myself, like all these bad things are going on. And yeah, so in young children, that can be definitely very dangerous.
Yeah, I also want to add something that we said in the presentation that this normally like affects people that live in low income, poor communities, like Black or Latinx children who they're more disproportionately affected by all this. So if they see shootings going in their communities or people that are dying or abusing guns, they might think that's, as Leah said, I need to stay safe. I need to carry a gun with me everywhere I go, which could cause them to actually like unleash a full-on shooting in a place.
Thank you. And a question from Bill. He asks, is bullying a big issue in your school and is it a component to gun violence?
Yes, 100% yes. And I have a perfect example. So I'm originally from Florida, and I remember MSD shooting, which is the Marjorie Stoneman Douglas shooting. And I remember reading lots of articles about the shooter, Nicholas Cruz. And if there's one article that really stood out to me, and I was like, oh my God, he was bullied relentlessly by peers. And some of those peers he shot and killed at the during the Marjorie Stoneman Douglas shooting. So yes, bullying is huge in school shootings and in gun violence. It's huge because if they see someone that's being bullied, they immediately want to shoot them because they've inflicted so much bad negativity into them. And they may think the correct way to just get rid of them is for them to die, even though that's not the correct way. And there's many different methods. And he should have gotten help when he needed it, but he didn't.
Yeah, kind of like what Martina said, um, experiencing bullying from a young age um, has these really monumental impacts on a child's mind. And having that feeling of powerlessness because of bullying um, makes these kids who, like we said in our presentation, may come from underrepresented communities and, in addition to that, also are experiencing a lot of bullying within their school. Um, it makes them want to have some sort of power over other people. And in these extreme cases, that is through violence and gun violence specifically. So, yeah, bullying definitely does play a huge role in violence and gun violence within schools.
I did want to add that in my school, well, I've never gotten bullied throughout my 3 years in high school. So I don't think it's that big in my school where I am. And I haven't seen someone get bullied in my school again. Definitely in like other communities and other areas, there could definitely be bullying though, to answer that other second part of your question.
Thank you too. And then Judy, another comment. She'd like to propose that the State League and the Pittsburgh League collaborate with our student interns on making a video starring them and their research to send out to all leagues. And hopefully prior to next year's convention. So yeah, and that's something that I'm sure you could discuss if that's something you have the capacity to do. It's a great suggestion, Judy. We appreciate that. And then to wrap it up, Bill's last question is, having done this study, does this inspire you to feel like getting involved in civics and potentially in government when you're able? I love that question, Bill.
Yes, it definitely does. It's really, really, really instilled like my love and also like my interest in criminal justice and like the justice system, how we can reform it, which definitely ties in a lot into the policies that Pennsylvania, that the US even has on gun violence and on guns. It really does inspire me to perhaps like work in the government, work in the legal field when I'm older, and I definitely do want to pursue that like in college, like maybe a double major in criminal justice or a minor in criminal justice. But yes, it does.
Yeah, into this internship, I had already had aspirations to go to college and focus on government, but doing this project specifically, I had never done so much research on this issue. And learning so much about this, it definitely inspires me to get involved in this next year in college. So, yeah.
Great. Thank you both so much. And then we also have Preston and Nancy here as well from the Pittsburgh League if they want to pop on and say hi. If they have any comments they'd like to add before we wrap up.
Hi there. Well, I know Martina from the convention. Good to see you again. And I had some reactions to your presentation. It's particularly in the way you responded to the questions, because that's when you can learn whether or not the research really got into your brains. And clearly it has. And that's really good. My initial question was, in the presentation, you talked about community-based approaches versus trauma-informed approaches. I'm not quite sure what those two are, actually. Somebody like to explain that?
Yeah, so community-based interventions is, I remember Martina talking a lot about that. That's things like safe to say, whereas you're going into schools mostly, that's what we focused on, and implementing these programs to inform students about the issue of gun violence, um, and take a preventative approach to just decreasing that issue. But trauma-informed approaches, that is more focusing on mental health. And I think that would focus more in hospitals and healthcare specifically. to mitigate the impacts of mental health that are exacerbated by gun violence.
Yeah,
So that,
to add on to the community also not only like schools, but also like expands to like neighborhoods as well, and like people living in different areas as well, and how that impacts like a community in general, the school, the people living in it, um, different organizations that help out there, etc. And then the trauma based, again, it's centered in like healthcare facilities, doctors, nurses, etc. But it also has to do with people that have witnessed gun violence, have seen it, well, witness, same as seen it, but
right.
have maybe they're the ones that inflicted the danger, or they were the ones that received the harm, etc., and how to help them, if that makes sense.
Sure. What did you see anything in your research, or what are your thoughts about introducing actually gun training into the school, as opposed to we had a great opportunity at the convention to hear from a teacher about how she basically instructs her kids in the classroom about gun, what do you do with the door opens and so forth. So we were all looking for corners to hide in. But would you see some value if in elementary school, and I think really elementary school is where we have to start, if everybody had an opportunity to learn about a gun, particularly a pistol, and how to care for it, um, how to um, basically shoot and get a feeling for the weapon so that they wouldn't want to play with it. I mean, I grew up certainly with cowboys and Indians and handguns and all that stuff. And a lot of kids still do. And they think of it as a toy. Is there a strategy that we could, let's say, make it them realize it isn't a toy?
Yeah, I definitely agree that education is really important. And you can't always count on parents to educate their kids about the realities of gun violence and responsible gun ownership. So that responsibility could fall to schools, and that would be like an example of like a school-based or community-based intervention method. But yeah, having that education would be important. I think that would be more beneficial for children like middle school age and up, just so they have a better understanding of it. But that's not to say that some sort of education wouldn't be beneficial in like younger children. Um, yeah, and I think that would be very beneficial to have along with the preventative approaches that are within schools now, such as what to do if an intruder comes in. Um, but I think having that like well-rounded understanding of gun violence will normalize the issue a lot less, and sort of help students understand how pressing it is and how dangerous guns are.
Yeah, I definitely agree with everything that Leah said. If I were to add something, I would say that for the education wise, I would definitely say for elementary students, maybe if they could get just like little glimpses into why guns, why gun violence, why school shootings are bad. Maybe through like comic books or like means of small reading materials for their age. Again, age appropriate, no blood, no nothing, but that gives them the lesson. Like the big lesson is guns are bad. You shouldn't use guns, etc. And then for middle school, like it could get a little bit like maybe in eighth grade, start actually again looking at like the mental effects of it and like why it's bad, how it affects your mental well-being. And then in high school as well, like maybe integrating that into an already created curriculum or of some sorts for the education wise. And then for what could you, for prevention. But then if a shooting happens, what do you do? Like a lot of students don't know what to do if an intruder arrives with a gun at their school. So definitely having students trained on what to do, where to hide, to be quiet, to not make any noise, to keep the doors shut, and to just stay silent is something that schools should really, really prioritize. In my old school in Florida, we used to have code red drills, which are what I said. We used to turn the lights off, we used to hide under the teacher's desk, we used to be silent, and the teacher just locks the door and she's like, okay, be quiet. And then the loudspeaker's like, okay, code red drill's over. Okay, we went back to class time. But here in Pennsylvania, in my school, we don't do that. And I think that's really wrong because if an intruder comes, everyone's going to go crazy and we're not going to know what to do. And if we go crazy, chances are the shooter's going to know that we're in there. So I
Just,
feel like some preventative methods like that could really help.
mhm.
I wanted to congratulate you on your great research and your analysis. I think you're right on. And I love hearing you talk first about, and this is community based, because I think that's probably where we need to start. We have to have the community behind what we see as a safe society. I was wondering, you're one of some of the first generations that have grown up with guns everywhere, and this whole concept of being shot when you go to school or something like that. How do your cohorts feel about what you've been doing in this gun thing? Are they enthusiastic? Do they not want to talk about it? How do they accept that?
I feel like it depends with whom you're talking to, because Gen Z is divided into so many different kinds of people. There's people who love joking about guns and who don't understand the importance and that school shoot not the importance, but like the critical role that having guns have on causing a school shooting. And they just like to joke about it or just don't comprehend it. There's some people that care about it, like us. And then there's other people that are unsure. They're like, yes, we do care about it, but we don't want to speak up about it, you know?
Mhm.
So I feel like it's divided into so many different levels. I feel that there's a lot of people that will support us, that do like what we're doing. There's some people that are a bit too shy, and there's some people that are like, it doesn't matter, like it won't affect us, and they don't really care about it, which
Yeah.
is wrong.
I definitely agree with what Martina said. I think if you ask maybe 10 people in my class, the answers you get could vary drastically depending on who the person is. I think part of the issue um, that our with our view of gun violence recently is that it is so political. Um, in my opinion, and an issue that affects so many people and that is so widespread and dangerous shouldn't be a political issue. However, that definitely plays into what different people say about it. But I think also a factor is that you never really feel like it'll happen to your school until it does. You never feel like it'll happen to your loved ones until it does. And I think that's something that, I mean, understandably, some people don't realize. And even if it doesn't impact you directly or impact your loved ones directly, it could. And um, it also impacts people like you who are just trying to go to school and learn. So, yeah, I think it definitely, the answers you get in people from people our age definitely vary. But
Yeah, and if I wanna ask something really quickly. Since it's become like the norm, a lot of people just think it's normal that a school could have a school shooting. And obviously that's not normal. And people like in our generation just think that it's the day-to-day, daily basis.
You had said something about how much violence people are exposed to. How do you think we should approach that? People don't like to be censored on much, but how do we keep kids from seeing this type of stuff and being inspired, or other people who are just sitting at home and watching? Um, do you have any ideas? I know it wasn't part of your study, but it's intriguing to me is how, so we have to worry about the First Amendment, but some things just should not be out there.
I'm very glad that you brought up that question, because that reminded me of when you go to movie theaters or when you go to the airport. So when you go to a movie theater, you can't scream bomb or fire. because you immediately get pulled out. But then if you go to the airport, you also can't scream bomb in the airplane because like then you'll also be pulled out or in the airport. And I feel like something, and that's normalized, like people understand that. And I've been to airplanes a lot, I've traveled to many places, and I haven't heard someone ever yell bomb or fire. And that's normalized. So I feel that if it could be normalized somehow, like in schools, that guns are bad, or just normalize that some words you just can't say or you just can't like write in social media, that could like really help. And to answer your question on like ways that we could do that, there's a lot of courses on digital citizenship and like how to be like a good digital citizen, like what you should say, what you can do. And I know Instagram has a feature that censors hate comments, so people don't look at it or they don't see it, which could prevent that. So I feel that those measures, if we increase them, and maybe AI could help as well with the rise in technology, it could really help combat that violence, that hate speech, kind of like comment that you said. But again, we have to tread carefully because again, it can't go against our First Amendment rights of free speech.
Yeah, kind of going off of what Martina said and focusing on specifically like children and teens viewing violence. Um, that sort of controlling how much violence they um, are exposed to is kind of hard to regulate. And unfortunately, I feel like that is something in children and teens that falls on the parent, which, parents won't always do. Um, and in that scenario, I think that's why schools are so important. That's why more resources has to be given to schools in this area. Um, because something we learned and something that I've actually experienced in my trainings, I'm actually working at like a school right now. Violent behavior and like indicative of trauma and mental health issues doesn't come from nowhere. Um, and if schools have the ability to recognize the signs and symptoms of potential mental health issues or traumas from being exposed to a lot of violent media, um, they'll be able to react to it and potentially have these intervention strategies.
So one of your recommendations really is to rely on the schools. I mean, so that all kids are exposed to the correct behaviors and that kind of thing. Yeah, that's good to know.
I know we're running out of time, but it seems that one of the things also that came across in your research is the role of the parent. And I was thinking of the parents poo-pooing what's being done in the school. And how do you overcome that? Um, one of the thoughts that I had when I learned about what teachers teach about what to do if there's a active shooter drill, um, was exposing the parents to it. On a parent, when every school system usually has at least one time when the parents come into the school and they meet the teacher and all that stuff. If a part of that could be having a drill, an active shooter drill on parents' night, and see if that changed any parental attitudes. I know the students, if they're there with their parents, many times they're not, but they would know what to do. And their parents would not, but they might have a feeling of the trauma, particularly if it wasn't an announced drill. Because I think that our adult population is part of the group that's not taking this stuff seriously. So
I'm going to pop in, even though I said I wasn't going to. I wanted to pop in because we're getting to the point where we're talking about changing the people who are doing the shooting instead of changing society's structure in ways that can prevent some of these things. We're never going to not have mentally ill people. We're never going to not have bad parenting. But we can have requirements for safe gun storage. We can raise the age of purchase. We can have gun product safety regulations that are proven to have an effect. And you guys did mention all of those in your presentation. I just want to like circle back to that instead of um, ending by focusing on changing hearts and minds of the shooters because that's not a solution that can ever be first of all, there's going to be a lot of pushback from the schools, from the parents. I don't want this indoctrination or whatever. But it's not, you don't start with the mentally ill person who may or may not shoot. You can do a lot with the product regulation, with the social regulation. So.
Thanks for uplifting that, Ruth. Yeah, so I think that's everything. Is there anything else that Nancy or Preston you'd like to add before I pass it back to Angelica to wrap it up?
Just congratulations on a great job.
I really did.
Yes.
Thank you both.
And I hope you can figure out ways to go on with this.
Thank you, Nancy. Go ahead.
Thank-
Angelica.
Yeah, thank you, Brianna. Yes, congratulations to both of our interns, and also Mia, who was unable to join us today. They've done such a great job over the past few months. And as they are wrapping up their presentation, we're hoping to publish some of our research in the Keystone newspaper, to talk more about what we found and what our recommendations are and what both of our interns, all three of our interns learned from working with the league. So we hope to have that published in sometime in the next few months. So we're working on a first draft of that, and then we'll just go back and forth on it. And thank you to Nancy, Ruth, and Preston for supporting us throughout this project. We learned so much from you and from you all, and we're so grateful to have worked with you. And lastly, thank you to Brianna for helping facilitate our webinar. It would have not been possible without you. And we're also so lucky to have worked with you throughout our presentation. And thank you for everybody for attending tonight. And please reach out to any of us if you have any questions. We can send out our slides and our research paper as well to all the attendees.
Thank you.
Bye, everyone. Thank you.
Thank you.